Welcome back. So in this next video, I'm going to show you what we do after we've prepared the tooth for a biomimetic onlay. This is still on the same day as the preparation. It's called immediate dentin sealing, and it's one of the things that's responsible for getting that very strong bond that is very important to make the material last and survive and behave like a natural tooth. So let's go ahead and dive right in there. I'm going to put my loops on and we'll get started. Okay, so looking at this tooth over here that's been prepared for the onlay, if we were not to do anything else, we wouldn't have a biomimetic restoration yet, okay? So far, we just have an onlay preparation, and in order to get a very strong bond to this, it's very important that we are doing things that will give us this strong bond. The thing that we need to do is called immediate dentin sealing. So we have a lot of dentin here. This is all enamel, but right here, this is all dentin. Dentin is very wet, it's moist, it's hard to bond to. So we need to do something called immediate dentin sealing. In order to do that, we're going to take our bonding agent, which is two parts. So we have something called a primer, which I'm going to scrub first. This primer goes right onto the dentin, and we go ahead and we scrub that on for about 15 seconds, 10 to 15 seconds. And what this is doing is it's helping us get a strong bond to the moist dentin. And as we do that, it's kind of removing any debris and smear layer and all these things that kind of make the surface hard to stick to. It's removing those things and giving us a nice layer to bond to. And after about that 10 to 15 seconds, we give that a little bit of an air dry for about 10 seconds. Okay, now the next part of our bonding agent is an adhesive. So this adhesive now goes over that same layer and we scrub it on. We usually don't want too thick of a layer. There's an amount that's just right, because if we go too thick with this, we have a little too much shrinkage, but if we go too thin, we don't get the strong bond. So what I normally do is I scrub it on and then clean off my brush here so it's nice and dry, and then I come back and I can wick up all the extra. So we just have just the right amount, and once that is all good, we go ahead and we actually use a light to make this layer hard. So I'm going to cure this for 20 seconds. And as we're doing that, what's happening is we're getting a bond to the dentin. A lot of dentists will tell you that you can't bond to dentin, or in the long run, bonds to dentin don't last. But in reality, the issue is the technique. You can bond to dentin. It's very predictable and very stable, but it does involve special techniques and understanding of the nature of dentin in order to do that. So once we've cured that, we have this layer that's kind of very light. It's almost a thin, clear coat. You can almost consider it like a coating, and it's called immediate dentin sealing. I like to put one more layer on top of that, and what we do with that is use a highly filled flowable resin, okay? This flowable resin is much stronger and thicker than the adhesive and helps to round off any sharp angles or areas of the preparation that need a little smoothing, but also helps establish that strong connection or bond to the tooth. So I put a little bit of that on there, and I use this instrument here to kind of take it all over and level it off, because I don't want too thick of a layer again. I just want to have a nice thin coat. So I use this instrument to go around, level it off. Perfect. And once I have everything the way I like it and everything's nice and smooth, notice, by the way, I'm only putting this on the dentin. I'm not going to the way outside, because enamel is not hard to bond to. We're going to bond to the enamel on the next visit, which is our cementation visit. But for now, we just want to seal the dentin areas, okay? And we did that, and now we're also coating them with this flowable, and I go ahead and I cure this. again for about 20 seconds. So now I have what's called immediate dentin sealing, and then I have a layer of flowable, which is called resin coating. Together, these things allow the bond to form to the tooth and give a very, very strong bond compared to a traditional approach of adhesion that a lot of people use, okay? And you can see it's nice and hard right now and all set. An example of why this is so important, okay? If you take a look at the instructions for anything that is adhesive, for example, in the bathroom, if you're hanging up one of those robe hooks or something like that, they tell you not to put any weight on it for 24 to 72 hours while the bond is getting stronger and stronger. And that's the same thing here. When I finish using my light on this, the bond to dentin is just starting to form. And over the next 24 to 72 hours, it gets stronger and stronger and stronger. And the reality is we're gonna come back in about 1 or 2 weeks to cement the final onlay here. And in that time, this bond gets stronger and stronger and stronger. That's one of the big techniques that allows time. Time is very important. Allowing time for this bond to form is a key concept. So we're gonna give that time, and it's gonna help make sure that our restoration behaves biomimetically and survives and lasts. So in this section, we covered what we do to the preparation after we've prepped it. This is all on the first appointment for the biomimetic restoration. It was called immediate dentin sealing and resin coating. It's a very important part of biomimetic dentistry. This is what makes this restoration different from just any other metal inlay or onlay. We're actually doing extra steps that help join. Very important, very key step here that every biomimetic dentist needs to do. Okay guys, in this section, we just finished covering what we do to the tooth after preparation. We covered immediate dentin sealing and resin coating, which are very important parts of the biomimetic approach. Without these steps, I would say you do not have a biomimetic restoration. So there's a lot of dentists out there that don't do these steps or say they're not important, and the science does not support that. These are very important steps that cannot be omitted, so make sure you understand the benefits. With immediate dentin sealing, you get a better bond, a better seal, more resistant to cavity, sensitivity, and leakage. These are all very important concepts you can't skip. In the next section, we're going to cover how we cement to this layer and continue with our lessons in biomimetic dentistry. Thank you for joining us, and see you next time.